forward and move to daylight saving time. And while a lot of people enjoy the longer days, the change can really wreak havoc on your sleep patterns. Joining us now, Dr. Thomas LoRusso, director of the Northern Virginia Sleep Diagnostic Center. And we're going to talk about that. Also, a new diagnostic tool for people with sleep problems that you can do at home. We'll talk about that too, but welcome back to the show. Good to see you.
Good to see you.
We still here on the morning show are not getting the sleep we need, so let's just say that. Let's get that out of the way. That was the same when you were here last time. Today, the National Sleep Foundation, though, is releasing its annual Sleep in America poll. Is there a new headline here? Is there something different, or are we still not getting the sleep we need as a nation?
We're still sleep deprived as a nation, unfortunately, and 1 in 5 Americans is still not getting the recommended amount of sleep. What we're starting to discover, too, is that these problems, when chronic, can lead to other health conditions such as depression, heart disease, diabetes. So it's becoming more and more apparent that we really need to get the adequate amount of sleep.
Why would it do that? Is it something with our cells not getting what they need, the nutrients? Why would it lead to other issues?
Well, part of it with relationship to cardiovascular disease is that you need to have enough time for the body to restore itself, okay? So there's restoration, there's chemical changes that occur at night that need to occur for the body to feel rested. When they don't occur, there can be stress on the system during the day, and this can lead to some of these chronic health conditions.
Okay. We're about to spring forward. It's always like, okay, is it the right time? Am I gaining all this? How do we get in front of this, doctor, and not make us go all cuckoo, our systems?
It's best to adjust over a couple of days. So what I recommend is try to get up 15 to 30 minutes earlier. Keep your weekday schedule for at least 2 to 3 days going in. Then at bedtime, try to set aside a good hour where you're relaxing, shutting off the electronics, because that bright light and the stimulation from those electronics can make it difficult to get back to bed. Keep a regular sleep-wake schedule and try to get into some bright light when you first wake up. That can be quite helpful in terms of resetting your clock.
Okay.
Also, cut back a little on caffeine and alcohol, particularly before bedtime. That can also affect your ability to adapt.
A lot of talk about, in those tips we saw it too, when to exercise. Some people say I exercise too close to bedtime, I can't get to sleep. Is there a formula there we should stick to as far as our exercise routine in the evening?
Ideally, you'd like to exercise at least 6 hours before bedtime. I'll sometimes tell people even up to 4 if that's the only time you can get the exercise in. Ideally, morning's great to exercise, especially if you can get out into bright light and do something outdoors.
Okay. You brought something with you that's really seems to me changing the game as far as diagnosing if you have sleep issues. Can you tell us about it?
Yeah, this is what's called a home portable sleep device, and this has allowed us to get more patients in the lab. It's certainly a more convenient device, and what this device is for is looking for something called sleep apnea. Patients that have difficulties breathing during sleep, they stop breathing, their airway obstructs, and it can be associated with some serious health consequences. The device itself works by basically monitoring your oxygen level. It tells us whether you're asleep or awake. And also there's a little airflow channel. So if you like me to demonstrate it, the device itself fits over the head like this. And then this little probe comes down here, fits in your nose, and then you adjust this back, tighten this up. And what you have basically is a portable sleep study. You can measure airflow. You can measure whether someone's breathing or not breathing. So the patient would sleep with this device on. We would take it, download it, and we'd be able to get results from a sleep study, very correlating very nicely to a home in-lab sleep study.
Right, which is overnight and all that. So before we let you go, who's eligible? How do we get to know if we're eligible for this, and do we have to come and visit a center like yourself to get this? Okay.
It's best to visit an accredited sleep facility or a board-certified sleep doctor, because there's certain patients that will do well with a home study, but there's others that really still should be done in the sleep lab.
Okay, we all know sleep apnea could be a killer. So thank you very much for demonstrating that. It's a brave man to put that on right here in the studio and to get it off. This is the director of the Northern Virginia Sleep Diagnostic Center, Dr. Thomas LoRusso. Thank you so much.
Thanks.
Tony, over to you.
All right, thank you both very much. It is a chance to discover the perils and privileges of 18th century pirate life, testing swords and cannons, and even touching